Biodent Care Services. Online dental portal. Shop with unique reward system. With rate and quality guarantee.
Description: R&D Series Nova Compo B Plus and is a light cure ethanol/water based, self-etching, one-step, all-in-one bonding agent. It can be used reliably in total etch, self-etch or selective etch mode for both direct and indirect restorations. The RDX multifunctional monomer registered creates a three-dimensional, high-strength bond. With calcium MDP, methacryloyl oxidesyl dihydrogen phosphate, monomer binds to Ca2+ ions on all surfaces of the tooth. The Nova Compo B Plus forms a micro-mechanical bond between the dentine channels to form the resin tags. Composition: R&D Series Nova Compo B Plus and contains hydrophilic aliphatic dimethacrylate, hydrophobic aliphatic dimethacrylates, 2-hydroxyethyl methacrylate, UDMA, urethane dimethacrylate, bis-GMA, MDP. Monomer, 10-methacryloyl oxidesyl dihydrogen phosphate, 4-met-RDX multifunctional carboxylated methacrylate polymer, silane, ethanol, water, highly dispersed silicon dioxide, 10%, DL-camphoraquine, and stabilizers. Advantages: the mild acidity so leaves denting tubuli closed to eliminate the sensitivity. Minimal technique sensitivity. No mixing and etching, priming and bonding are captured in one material, can be used without having to rinse and rub. Highest bonding strengths to both dentin and enamel for 7th generation. Combined total etch, self-etch, and selective etch adhesive. Enamel self-etching technique to connect with 29 MPa. The value of dentin bonding to 30 MPa. Dry the dentin bonding value of 29 MPa. Moist dentin bonding value of 30 MPa. Low film thickness, 8 to 10 U. pH is 2.8. Recommended indications: direct piecing, light curing composite or compomer filling materials. Bonding of core build-ups made of light curing composite or core build-up materials. Repair of composite or compomer fillings. Adhesive cementation of indirect restorations with light and dual curing luting composites. Sealing of prepared tooth surfaces before temporary permanent cementation of indirect restorations. Root surface desensitization. Dentine protector properties. Bonding of fissure sealants. Intraoral repair of composite restorations, porcelain fused to metal, and all ceramic restorations without extra primer. Protective varnish for glass ionomer fillings. Contraindications: R&D Series Nova Compo B Plus and must not be used in combination with purely self-curing composite materials without dual cure activator. Dual curing materials always have to be light activated. Do not use R&D Series Nova Compo B Plus and for direct pulp capping. Do not use R&D Series Nova Compo B Plus and if a patient is known to be allergic to any of the materials, ingredients, or if the stipulated working technique cannot be employed. Procedure for direct and indirect restorations. 1. Isolation. A dry operating field must be ensured. Ideally, a rubber dam should be placed. 2. Pulp protection cavity liner. In very deep cavities, close to the pulp must be coated with a calcium hydroxide liner, and subsequently covered with glass ionomer cements. 3. Conditioning with phosphoric acid gel, optional. Higher adhesive values can be achieved by selectively etching the enamel or using the total etching procedure. A selective enamel etch technique. Apply phosphoric acid gel, Panora 200, onto the enamel and allow it to react for 15 to 30 seconds. Then rinse thoroughly with a vigorous stream of water for 5 seconds and dry with compressed air until the etched enamel surfaces appear chalky white. Do not over-dry. 4. Dosing adhesive. Dispense the desired amount of R&D series Nova Compo B+ and into a mixing well and apply it using a disposable applicator. Protect the adhesive from light with a protective cover. Close the bottle immediately after each use. 5. Application of the adhesive. Starting with the enamel, thoroughly coat the tooth surfaces to be treated with Nova Compo B+. The adhesive must be scrubbed into the tooth surface for at least 20 seconds. This time must not be shortened. Note, the higher bond values can be achieved with an alternative method. Apply 2 separate coats of R&D series Nova Compo B++, scrubbing the preparation with a microbrush for 15 seconds per coat. Do not light cure between coats. Disperse R&D series Nova Compo B+ and with oil and moisture-free compressed air until a glossy solvent has evaporated completely. 5 seconds low and 5 seconds high air, immobile film layer results. Light cure R&D series Nova Compo B+ and for 10 seconds using a light intensity of 2500 mW/cm2. 6. Intraoral repair of fractured composite restorations with light curing materials. Roughen the restorative surface to be repaired with a diamond finishing burr or blasting with 30 to 50 alumina powder, clean with water spray, and dry with oil and moisture-free compressed air. The working steps are the same as the application used for direct-indirect restorations with R&D series. Side effects. Components of Nova Compo B+ and can rarely cause sensitivity. Nova Compo B+ and should not be used in such situations. Interactions. The use of peroxide-containing materials, peroxide-based whitening agents or disinfectants, may interfere with the polymerization of adhesives. Such materials should not be used from Nova Compo B+ and at least 14 days prior to application. Phenolic substances, e.g. eugenol, salicylic derivatives, repress the polymerization of Nova Compo B++. Iron and aluminum-based bleeding arresting agents should not be used during or shortly before application of Nova Compo B++. Fluorinating agents should not be used before R&D series Nova Compo B+ and application. Disposal must be made according to official regulations. Take to an approved landfill or a waste incineration plant, under conditions approved by the local authority. Uncleaned packagings, disposal must be made according to official regulations. Cautions. Avoid contact with the skin, mucous membrane, and eyes. In case of skin contact, immediately wash with soap and copious amounts of water. If the material should accidentally come in contact with the eyes, immediately rinse with copious amounts of water and consult a physician ophthalmologist. In rare cases, contact with skin may lead to sensitization towards the ingredients. Commercial medical gloves do not provide protection against the sensitizing effects of methacrylate. Phosphoric acid gel is corrosive. Avoid contact with the skin, mucous membrane, and eyes. Goggles are recommended for both the patients and practitioners. If the material should accidentally come in contact with the eyes, immediately rinse with copious amounts of water and consult a physician ophthalmologist. Storage. Storage temperature, 4 to 25 degrees C/39.2-77 degree F. Keep out of the reach of children. Packaging. 5 ml dropper bottle 50x bonding applicator pellets 25x double adhesive platforms.
Exclusively available in Pakistan at Biodent Care Services. For orders and more details, log on our online dental portal www.biodent.com. Call or WhatsApp +92-333-0270-507. Email sales@biodent.com.